The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions helps his patient lose weight. Clinical psychologist Dr. Collins Hodges talks about how he works with the entire family to treat behavioral problems in children and adolescents. Minimally invasive spine surgeon Dr. Douglas Wan talks about an innovative surgical technique he developed called Lumini Microinvasive Surgery. Craniofacial and plastic surgeon Dr. David Jenikov discusses his detailed and customized approach to rhinoplasty. Reproductive endocrinologist Dr. Robert Kaufman talks about how his fertility practice offers the highest level of multidimensional patient care.
I struggled pretty much my whole life. I was always the big kid. And being that I am almost 5'9" tall, plus being heavy is, weighs on your mind a lot. Even though I was still active, I still was a volume eater and turned to that really for emotion more than anything. You just get to the point where you struggle with it, you do a diet here, it works, you gain it back +10, and that was a yo-yo effect of my life.
When Shannon came to see us, she was unable to lose and other methods. She'd tried multiple ways to do that. She also had several other health problems that she wanted to remedy.
I wanted to make a lifestyle change, period. I was nervous, but I was ready. As scared as you might be, especially I had never had a major surgery, I was ready to go. And I felt very comfortable having met Dr. Stowers. I just felt like I was in the best of hands.
Fitting into her lifestyle was a big part of the selection process for her. She didn't really need our more advanced surgeries or bypass, so a sleeve fit her lifestyle more. At 3 months, most people lose about 20% of their body weight. So you can multiply 20% how much you weigh, and that's a pretty typical sleeve loss.
That first 6 pounds was great, and then, before you know it, it's up to 20. And you put on a pair of sweats that were your comfy sweats and they don't fit. So you got to tie them for the first time in your life. And that's a great feeling.
I've seen Shannon after 2 years now. I had to look at her old pictures and look at the new ones so I knew who she was. It's an amazing transformation.
After having gastric sleeve procedure with Dr. Stowers, I've lost a total of 110 pounds. Looking in the mirror is when you've seen yourself for so big for so long and always been the pretty face. It's almost surreal. I still sometimes see myself as that person. And then lifelong friends are like, I don't even recognize you on the street. People you went to school with don't know who you are. Knowing that the work you put into it yourself makes it very rewarding for you.
Another reason to stay hydrated throughout the day is because your brain is composed of 75% water. Your brain will also begin shrinking 0.25% in mass each year after the age of 30.
Behavioral management is all about changing negative behaviors. My goal is to promote healthy families. We're here to promote healthy relationships. I work with parents to identify specific problematic behaviors. When parents come in and their children have behavioral problems, the first thing we want to do is target any stressors that are going on. And number two, identify what those behaviors are. Once we've identified those, I want to really get together with the parents and see how parents are implementing consequences to those behaviors. For example, we want consequences to be specific, immediate, consistent, and we want them to be meaningful to the child. We want children to feel like they're being recognized and noticed and reinforced for positive behaviors, ideally more often than the negative behaviors. We want children to feel good about their interactions with their parents. And parents want to feel good about their interactions with their children. There's a lot of emphasis I place on establishing trust, really getting down to understanding how the child perceives his or her problems. What is it exactly in his or her world that is giving him or her difficulties? The core of setting up a behavioral management program is setting up a behavioral contract that links wanted behaviors with privileges, and working together as a group to create kind of a scenario in which there's an outline for success, and it's something that can be checked on a weekly basis at home and then in the office. My goal is to promote healthy relationships between parents and their children. It's about kids feeling good about their relationships with their family and their friends. And same thing for the parents. I want them to feel good about the interactions they're having with their kids.
Find your doctor on bestdocsnetwork.com.
At Lumen Health Spine Care, we developed the latest and the most innovative minimally invasive surgical technique, and it is called Lumini Microinvasive Surgery. This is utilizing the most modern technology so that we can preserve all the normal tissues in your spine without creating any kind of damage to your back and without stripping the muscles. We make extremely small incision and go between the muscle fibers with an endoscope to perform the same procedure as if we performed a traditional open back surgery. The big advantage is that the patients are not going to have significant amount of pain. They're not going to have their muscles stripped off their spine, so therefore it minimizes the bleeding, scarring, pain, so that they could recover so much faster. Patients after undergoing Lumini microinvasive surgery are discharged to home on the same day or the very next day, depending on the type of procedure they're having. And many of the patients can return back to work or their light duty activities pretty immediately after the surgery. So we evaluate the patient to see if they're candidate for Lumini microinvasive surgery by having a full consultation and evaluation, and patient may undergo imaging studies or pain mapping process by our interventional pain specialist so that we can clearly identify and accurately identify their pain generator, and so that we can perform the least invasive procedure for the patient. We developed Lumini microinvasive surgery because I personally witnessed it from my father, who had multiple open back surgery. He went through a significant amount of pain, developed chronic pain, and he had a failed back syndrome and lived 30 years of his life with significant amount of pain. And watching him suffer, I realized that we must do something better than what we're doing now to help all those patients with significant amount of back pain and chronic pain. So we used all the latest technology, worked closely with the engineers to develop the least invasive way to approach the spine.
Diane has a question for Dr. Guy Lewis. What is the best way to get a wider smile?
Well, there are a couple of ways to get a wider smile. One way would be to bleach your teeth. Bleaching can work well for some people, but it doesn't work well for everyone. It just depends on the makeup of your teeth. So that's an easy way to try and see if it works for you. But for a more predictable result, and something that is going to be exactly like you want it to be, then doing veneers is the best way to do that. We can make them any color you want. We can change the shape, size, a lot of different things, but the color can be picked out and said, this is the color I want, and that's the color we can make them. With bleaching, you also have maintenance, whereas you bleach them up, and they may not stay that color for very long. You may have to bleach them every 2 or 3 months to maintain that. So doing veneers, you do it, it's done. Doing the bleaching, more maintenance, but you can get a good result with the bleaching.
Ask our doctors on bestdocsnetwork.com.
Before I had the surgery, I was pretty unhappy with my nose. It had a big bump and it kind of was wider on my face. So I knew I wanted to have it when I was like probably hit high school. And so I waited till after I graduated and did it.
So Melanie had a few issues. She had a very broad nose. Both the bone structure as well as the tip were very broad, and the tip of the nose dropped a little bit and was also undefined. So the goal for Melanie's nose was to narrow it, to narrow the tip, to raise the tip, and give her better definition, including straightening the septum internally.
When I initially came to see Dr. Genikov, he took me in for a consultation and he took photos of the side and the frontal view of my nose, and then he showed me on the computer what it could look like, and I was pretty happy with what he envisioned for it. Dr. Genikov told me, it was a big decision to make, but he talked me through it, and any questions I had about pain or what it was going to look like, he answered them.
Noses are a little bit different. They require a little bit more time. So when I talk to patients about rhinoplasty, it's important for me to understand what the patient wants. The first thing I do is I sit down and talk to the patient, and I ask them what bothers them. I ask them, kind of what they think they want their nose to look like. Additionally, I ask them if they have any functional problems, breathing problems, if they ever fractured their nose. The other thing that I do, I think, which may be a little bit different, is I do computer imaging after the patient has decided they want an operation. I want to make sure that the patient sees patients of mine, their befores and afters, and kind of sees, that looks like my nose, or that looks like my nose, and I like that result.
Before I got the rhinoplasty, I was definitely self-conscious of my nose, always trying to hide it, and because it was the main focus on my face because it was wider, and after, it's definitely balanced out, and so it made me a lot more self-confident.
Nuts are not only a source of healthful fats and protein, they also are a massive dose of omega-3 fatty acids that can help boost your brain power.
At Fort Worth Fertility, what we really want to do is help our couples get pregnant, and we really believe this is the place for them. We can provide them with the best care from an emotional standpoint, from a success standpoint, and we can make you feel like you're in a unique situation here where we'll treat you as an individual, and we'll do the very best we can to help you achieve your goal. We look for unique situations for our patients. We try to tailor what their individual needs are. I think the importance between our center and other centers would be we're very upfront with patients. We let them know what their expectations to get pregnant are. We let them know what it's going to take to get pregnant. We know financially what it's going to take for them to get pregnant. In addition, we offer numerous treatments. We offer inseminations where we put sperm inside the womb. We offer in vitro fertilization where we'll put embryos inside the womb. We can offer surgery. We can offer fertility medications. And there's a host of other things we can offer patients at this center, everything under one roof for the convenience of our patients. Our typical first patient appointment is where we'll actually spend probably about an hour talking about things. We'll talk about their history, we'll talk about possible evaluations they may need, and then we'll even start talking about potential treatments. When we talk about treatments, we'll let them know what their chances of getting pregnant are, how much it's going to cost, and what do they need to do. And so we really try to evaluate it thoroughly so we don't miss anything, so we can give them the best options to get pregnant. We're very proud of our egg donation program and surrogacy. We're known internationally for that. So it's not just Fort Worth. You think, oh, we just get doing things in Fort Worth. But we really see patients from all over the United States and all over the globe. And we're honored enough to be able to treat those type of patients here in Fort Worth. The other aspect here at Fort Worth Fertility is our staff. I think we have an outstanding staff, and we all need to work as a team to get the job done. We do know there's a lot entailed in helping our patients get pregnant. But we do try to find a cost-effective means to try to get our patients pregnant and give them our best advice on how to accomplish that.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Coming up on the second half of today's show, ENT surgeon Dr. C.T. Nguyen talks about how he treats those with postnasal drip and deviated septums. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Interventional cardiologist Dr. Annie Varghese discusses the signs and symptoms for severe carotid stenosis. Houston Northwest Medical Center highlights their nurses' commitment to patient care as well as to their community. Plastic surgeon Dr. David Altamira gives his patient the looks she's always wanted.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple courses of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what he can do for me and what would be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
Request an appointment on bestdocsnetwork.com.
Meningitis can be a bad disease. There's 3 or 4 different kinds. The main kind is viral meningitis. That's relatively mild and doesn't really harm people, it just makes them sick for a while. Bacterial meningitis can be very bad. That's the one that can make you very, very sick, wind you up in the hospital, can even kill you. There's also things like fungal meningitis. This is the one that we recently heard about with the contaminated steroid shots. How do you tell if you have meningitis? Well, you have to be pretty sick to have meningitis. For example, your fever is usually pretty high, not low. Generally, you have the headache, usually described as the worst headache of your life. If you have a mild or moderate headache, that's one thing. If you have the worst headache that you've ever had in your life, then you gotta think meningitis. Also, you may have a rash, you may have a stiff neck, and generally people with meningitis just look horrible. So if you have a little bit of a headache and a little bit of a fever and feel a little bit horrible, that may just be a regular old virus. If it's real bad on the headache side and real bad on the fever side, then you got to think about meningitis, and obviously you should see your physician.
Miss Richardson, wonderful woman, very busy, and she was just dizzy, and she wanted to be checked out. And we did our routine screenings of our patients where we check the heart with ultrasound, the carotids, ultrasound, aorta, legs, all of those things. But what we found was large plaque in the carotid, large plaque, and with a very abnormal velocity or blood flow.
But she sent me to have an MRI, and they found something, and so they sent me to a neurologist who ran tests and finally sent me to have a CAT scan and found out that my carotid artery was blocked. So she sent me to St. Luke's to a Dr. Krager who put a stent in.
People will have dizziness. Sometimes there are no symptoms. So silence is not golden here. Silence is deadly. So that's why it's so important to be checked. In the literature, of course, we know that the older we are, the more oxidative stress, the more plaque formation occurs in the vessels. But I have found young people to have already atherosclerosis or plaque formation. So if we can find it at a younger age, in their 20s and 30s, that they're developing plaque, we can protect them from presenting like Ms. Richardson did, you know, with a severe blockage that could only be fixed by surgery.
She's very personable. She has plenty of time to talk to you and tell you what the symptoms are and what can be done, and she's very caring.
Carotid disease can also present with symptoms of numbness or tingling, difficulty speaking, changes in the facial shape. Basically, people may not be able to smile, or maybe they've had small strokes where they can't move their face or speak or move their arms or legs like they used to. So those things should be checked even if they're subtle. You should check with their doctor.
When you find a doctor that you can recommend to your friends and to your family, it's great. I'm not a big fan of doctors, but I just love her to death.
Carla has a question for Dr. Peter Morgan. What are the causes of venous insufficiency?
The risk factors or causes of venous insufficiency are, first of all, genetic or hereditary. Patients that have parents or grandparents or aunts or uncles that have large varicose veins are more likely to have disease that is caused by a genetic predisposition for the veins to get larger. The second risk factor is lifestyle issues, including jobs, occupations, or hobbies that result in standing or sitting for long periods of time.
Ask our doctors on bestdocsnetwork.com.
At Houston Northwest Medical Center, we're immensely proud of the wonderful group of nurses that we have at our hospital, not only for the care they give to our patients every day, but also for the way that they've reached out and become so involved in our community.
Their commitment to the patient here at Houston Northwest is amazing, but in addition, above and beyond these four walls, they carry it out to the community. And that's evidence in all their volunteer work, through runs, through patient support groups, through educational opportunities they offer to the community.
One of the reasons that I really like working for Houston Northwest is its philosophy, its commitment on giving back to the community. And so when an opportunity came up from Spring Independent School District for me to be a part of their education foundation, the hospital was very supportive in not only its financial resources, but allowing me the time to be able to participate at a high level of engagement with our school district.
Race for the Cure has become a really important tradition here at Houston Northwest Medical Center. Living the walk with these ladies, they allow you to walk beside them, behind them, in front of them, holding their hands. That's very important. That's something you cannot buy or you can express in words, really. I'm very honored. I am honored to be part of their lives and do whatever I can to help them along the way.
When I first started working here is when I got involved in the Heart Walk just as a participant. And after just participating for a couple of years, they asked me to kind of take it over. And so now that's what I do, is I help raise money for the American Heart Association Heart Walk.
Relay for Life is the biggest fundraiser sponsored by ACS.
So American Cancer Society is always collecting donations to go towards patients that are underprivileged or that need resources when facing their diagnosis. It's humbling because I get to see patients come in that get a diagnosis that is life-changing, and then to be able to see them walk around the track as a survivor or one of their family members to walk around the track in remembrance of them. I feel lucky that I get to be the person to represent our hospital in that. I love my job. It's fun. It feels good to be helping people live a healthier lifestyle.
Obviously, we're very proud of the quality of care that's provided at Houston Northwest Medical Center, and our nurses are the driving force behind that. But their commitment to quality care and their commitment to our community extends well beyond the walls of our hospital through the many charitable and healthcare awareness events that they participate in actively throughout the year.
I think that gets to the core of nursing here. There's a heart, a big heart.
Deep breathing can help you relax, but that dose of oxygen will also make you feel happier and more alert. Practice this by taking deep breaths, sucking air in through your nose until your lungs are full.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body. And she thought, you know, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get, what would you say, a pouch and scar tissue buildup. So, you know, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have this loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, wanted to get back to me. I got my sexy back.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.